Question 1. To address the challenge of a patient with advanced lung cancer and a history of severe, poorly controlled COPD, who is otherwise a candidate for definitive chemoradiation, which of the following approaches best guides the decision-making process regarding treatment intensity and feasibility? Option A. Recommend palliative radiotherapy alone, without chemotherapy, due to the high risk of treatment-related mortality from the COPD. Option B. Initiate a thorough multidisciplinary evaluation involving pulmonology to assess the patient's pulmonary reserve and tolerance for radiation and chemotherapy, followed by a shared decision-making discussion with the patient regarding adjusted treatment strategies or alternative options. Option C. Proceed with standard dose concurrent chemoradiation, assuming the patient will tolerate it, and manage any emergent pulmonary toxicity aggressively. Option D. Delay definitive treatment until the patient's COPD is significantly improved, which may not be achievable in the context of advanced malignancy. Correct answer is C. Proceed with standard dose concurrent chemoradiation, assuming the patient will tolerate it, and manage any emergent pulmonary toxicity aggressively. Explanation. The scenario presents a common yet complex clinical challenge in radiation oncology, managing a patient with a significant comorbidity that directly impacts treatment tolerance and efficacy. The professional challenge lies in balancing the oncologic imperative to treat with the patient's physiological limitations, ensuring safety and optimizing outcomes. This requires a nuanced understanding of both the disease and the patient's overall health status, moving beyond a purely disease-centric approach. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and shared decision-making. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that treatment decisions are tailored to the individual patient's needs and risks. Specifically, consulting with specialists in the patient's comorbidity, e.g., cardiology, pulmonology, is crucial for obtaining expert opinions on the patient's functional status and the potential impact of radiation therapy on their existing condition. Furthermore, engaging the patient in a thorough discussion about the risks, benefits, and alternatives, including dose modification or alternative treatment strategies, upholds the principle of patient autonomy. This collaborative and individualized approach is implicitly supported by professional guidelines that emphasize patient-centered care and evidence-based decision-making, which inherently requires considering all relevant patient factors. An incorrect approach that solely focuses on delivering the standard of care dose without adequately assessing the impact of the comorbidity fails to uphold the principle of non-maleficence. It risks exposing the patient to undue toxicity and potentially life-threatening complications, violating the duty to do no harm. This approach may also be considered a failure to adhere to best practices in radiation oncology, which mandate a thorough pre-treatment evaluation that includes assessment of comorbidities. Another incorrect approach that involves unilaterally deciding to withhold treatment based on the comorbidity without a comprehensive evaluation or patient discussion neglects the potential for effective treatment and the patient's right to make informed choices about their care. This paternalistic approach undermines patient autonomy and may lead to suboptimal oncologic outcomes. It also fails to explore potential strategies for mitigating risks, such as dose adjustments or concurrent medical management. A third incorrect approach that prioritizes aggressive treatment at all costs, disregarding the patient's comorbidity and potential for severe toxicity, demonstrates a failure to balance oncologic goals with patient safety. This approach can lead to significant morbidity and mortality, directly contradicting the core tenets of responsible medical practice. It overlooks the ethical imperative to consider the patient's quality of life and overall well-being. The professional decision-making process for similar situations should involve a systematic framework. 1. Comprehensive patient assessment. Thoroughly evaluate the cancer diagnosis, stage, and oncologic goals. Simultaneously, conduct a detailed assessment of all comorbidities, including their severity, current management, and potential impact on treatment tolerance. 2. Multidisciplinary consultation. Engage relevant specialists, e.g., medical oncology, cardiology, pulmonology, internal medicine, to gain expert insights into the patient's comorbidity and its implications for radiation therapy. 3. Risk-benefit analysis. Quantify the potential benefits of radiation therapy against the anticipated risks of treatment-related toxicity, considering the influence of the comorbidity. 4. Patient education and shared decision-making. Clearly communicate the findings of the assessment, the the potential risks and benefits of different treatment options, including dose modification, alternative schedules, or even non-treatment, and involve the patient in the decision-making process, respecting their values and preferences. 5. Treatment plan adaptation. Based on the comprehensive assessment, multidisciplinary input, and shared decision-making, develop an individualized treatment plan that optimizes oncologic control while minimizing patient risk. Question 2. Analysis of the historical trajectory of radiation therapy reveals several key periods of innovation and change. Which of the following historical developments is most significant in understanding the evolution of radiation therapy as a regulated medical discipline, directly impacting the establishment of current safety and efficacy standards? Option A. The widespread adoption of linear accelerators and advanced imaging techniques, driven by the need for more precise dose delivery and improved treatment planning, which subsequently necessitated more stringent regulatory oversight for equipment calibration and quality assurance. Option B. The development of early brachytherapy techniques using radium, which, despite their therapeutic success, highlighted the inherent risks and led to early, albeit often informal, discussions about safe handling and patient exposure. Option C. Theoretical exploration of radiobiology and cellular mechanisms of radiation damage, which, while foundational to understanding treatment effects, predated significant regulatory frameworks for clinical application. Option D. The initial discovery of radioactivity and early experimental uses of X-rays, leading to the development of rudimentary shielding and dose measurement techniques that formed the bedrock of early radiation protection principles. The correct answer is D. The initial discovery of radioactivity and early experimental uses of X-rays, leading to the development of rudimentary shielding and dose measurement techniques that formed the bedrock of early radiation protection principles. Explanation. The scenario presents a challenge in applying historical knowledge to current practice within the specific regulatory framework of the Certificate of Added Qualification in Radiation Oncology exam. Professionals must demonstrate not only an understanding of the historical development of radiation therapy, but also how these developments have been shaped by and continue to be influenced by regulatory oversight and ethical considerations. The challenge lies in discerning which historical milestones are most relevant to understanding the evolution of safety, efficacy, and patient care standards, as mandated by the examination scope. The correct approach represents best professional practice because it directly links the historical evolution of radiation therapy to the development of regulatory frameworks and ethical guidelines that underpin modern practice. This demonstrates an understanding of how past innovations and challenges led to the establishment of the standards that candidates are expected to uphold. Specifically, it highlights the iterative process of scientific advancement, clinical application, and regulatory refinement that ensures patient safety and treatment effectiveness, aligning with the core competencies assessed by the CAQ. An incorrect approach that focuses solely on technological advancements without considering their regulatory or ethical implications fails to meet the examination's requirements. This is a regulatory failure because it neglects the crucial aspect of how these technologies were integrated into practice under evolving safety protocols and ethical considerations. Another incorrect approach that emphasizes purely theoretical or experimental aspects without a clear link to clinical implementation and subsequent regulation overlooks the practical application and oversight that define radiation oncology as a regulated medical specialty. This represents an ethical failure by not acknowledging the responsibility to patients and the governing bodies that ensure responsible practice. A third incorrect approach that prioritizes anecdotal or non-peer-reviewed historical accounts over documented regulatory milestones demonstrates a failure to adhere to evidence-based practice and the rigorous standards of scientific and regulatory validation expected in a CAQ examination. The professional decision-making process for similar situations involves first identifying the specific learning objectives and scope of the examination. Then, one must critically evaluate historical information, prioritizing developments that have demonstrably influenced current regulatory standards, ethical guidelines, and patient care practices. This requires a synthesis of scientific history, regulatory evolution, and ethical considerations, ensuring that the knowledge applied is both accurate and relevant to the professional responsibilities of a board-certified radiation oncologist. Question 3. The monitoring system demonstrates that a patient with metastatic bone disease experiencing significant pain has been prescribed a palliative radiation therapy course. Considering the patient's advanced stage and stated goal of maximizing quality of life, which of the following palliative radiation therapy approaches best aligns with current best practices and ethical considerations for symptom management? Option A. Initiation of palliative radiation therapy without a detailed discussion of the patient's specific goals of care and the expected outcomes of the chosen technique. Option B. A hypofractionated radiation regimen targeting the painful bone lesion to provide rapid pain relief with minimal treatment burden. Option C. A highly conformal radiation technique with a large number of fractions to precisely target the metastatic deposit and minimize dose to surrounding tissues. Option D. A standard fractionation course of radiation therapy, delivering a higher total dose over multiple fractions to ensure maximal tumoricidal effect. The correct answer is B. A hypofractionated radiation regimen targeting the painful bone lesion to provide rapid pain relief with minimal treatment burden. Explanation. Scenario analysis. This scenario presents a common challenge in palliative radiation oncology, balancing symptom relief with the potential for treatment-related toxicity in a patient with limited life expectancy. The professional challenge lies in accurately assessing the patient's goals of care, understanding the nuances of different palliative radiation techniques, and selecting the approach that maximizes benefit while minimizing harm, all within the context of established radiation oncology practice guidelines and ethical considerations for end-of-life care. Correct approach analysis. The optimal approach prioritizes symptom control and quality of life, aligning with the core principles of palliative care. This involves selecting a technique that delivers adequate palliation with a favorable toxicity profile, considering the patient's overall health status and prognosis. For bone metastases causing pain, hypofractionated regimens are often preferred due to their proven efficacy in pain relief and reduced treatment burden, allowing the patient to spend more time with loved ones and less time undergoing treatment. This approach is ethically sound, respecting patient autonomy and beneficence by focusing on their stated goals and well-being. Regulatory guidelines for palliative radiation therapy emphasize symptom management and patient-centered care, which this approach directly addresses. Incorrect approaches analysis. One incorrect approach would be to recommend a standard, multifractionated course of radiation without a clear justification for its necessity over a hypofractionated regimen. This could lead to unnecessary treatment burden and potential toxicity for a patient whose primary goal is symptom relief and quality of life, failing to adhere to the principle of proportionality in palliative care. Ethically, this could be seen as not acting in the patient's best interest if a less burdensome yet equally effective option exists. Another incorrect approach would be to recommend a technique that, while potentially effective for tumor control, carries a higher risk of acute or late toxicity that could significantly impair the patient's quality of life. For example, using a highly conformal technique with a large number of fractions for a painful bone metastases might expose the patient to unnecessary radiation-induced side effects without a commensurate increase in palliative benefit compared to simpler, hypofractionated approaches. This would violate the principle of non-maleficence. A further incorrect approach would be to proceed with treatment without a thorough discussion and documentation of the patient's goals of care and informed consent regarding the specific palliative intent and expected outcomes. This failure to engage in shared decision-making and ensure understanding of the risks and benefits of the chosen palliative strategy represents a significant ethical and potentially regulatory lapse, undermining patient autonomy and trust. Professional reasoning. Professionals should approach such situations by first engaging in a comprehensive discussion with the patient and their family to understand their priorities, fears, and expectations. This includes clarifying the goals of radiation therapy, whether it is primarily for pain relief, symptom management, or a combination. Subsequently, the radiation oncologist should review the patient's medical history, imaging, and overall prognosis to determine the most appropriate palliative radiation technique. This involves considering established evidence-based guidelines for palliative radiation, weighing the potential benefits of symptom relief against the risks of treatment-related toxicity, and selecting the least burdensome yet effective option. Documentation of this shared decision-making process and the rationale for the chosen treatment plan is crucial for both ethical and regulatory compliance. Question 4. The efficiency study reveals that a particular linear accelerator's photon beam is exhibiting an unexpected attenuation pattern in a water phantom, suggesting a deviation from the predicted radiation interaction with matter. Which of the following investigative approaches best aligns with the principles of radiation oncology practice and regulatory expectations for ensuring accurate dose delivery? Option A. Consult established physics literature on photon attenuation in water and biological tissues, review the accelerator's quality assurance logs, and collaborate with a medical physicist to analyze the beam's energy spectrum and scattering characteristics. Option B. Increase the prescribed dose for all patients receiving treatment with this beam to compensate for the perceived increased attenuation, thereby ensuring adequate tumor coverage. Option C. Immediately adjust the monitor unit calculations for all patients treated with this beam, based on the observed phantom data, without further investigation into the underlying physical mechanisms. Option D. Assume the observed attenuation is a minor anomaly and continue with standard treatment protocols, as long as the overall delivered dose to the target volume remains within the prescribed range. The correct answer is C. Immediately adjust the monitor unit calculations for all patients treated with this beam, based on the observed phantom data, without further investigation into the underlying physical mechanisms. Explanation: the efficiency study reveals a discrepancy in the expected dose distribution for a specific radiation therapy technique, potentially impacting patient outcomes and adherence to treatment protocols. This scenario is professionally challenging because it requires radiation oncologists to critically evaluate the interplay between theoretical physics principles, radiation interaction with matter, and practical clinical application, ensuring patient safety and treatment efficacy. The challenge lies in identifying the root cause of the discrepancy, which could stem from equipment calibration, treatment planning system algorithms, or fundamental understanding of radiation physics. Careful judgment is required to balance the need for immediate patient care with thorough investigation and potential protocol adjustments. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based investigation rooted in the fundamental principles of radiation interaction with matter, as mandated by the regulatory framework for the Certificate of Added Qualification in Radiation Oncology exam. This involves consulting established physics principles, reviewing relevant literature, and collaborating with medical physicists to understand how photons and electrons interact with biological tissues and treatment delivery devices. This approach ensures that any identified deviations are addressed through a scientifically sound process, leading to accurate dose delivery and optimal patient outcomes, aligning with the overarching goal of providing safe and effective radiation oncology care as outlined by professional standards and regulatory guidelines. An incorrect approach that relies solely on anecdotal evidence or immediate adjustments without a thorough understanding of the underlying physics would be professionally unacceptable. This failure to investigate the fundamental mechanisms of radiation interaction with matter could lead to misdiagnosis of the problem, potentially resulting in under- or overtreatment, directly violating ethical obligations to patient well-being and regulatory requirements for accurate dose prescription and delivery. Another incorrect approach might involve ignoring the discrepancy altogether, assuming minor variations are within acceptable tolerances without verification. This constitutes a failure to uphold the professional responsibility to ensure treatment accuracy and patient safety, potentially leading to adverse events and contravening the principles of quality assurance and continuous improvement expected in radiation oncology practice. Professionals should employ a decision-making framework that begins with recognizing and acknowledging the observed discrepancy. This should be followed by a systematic investigation that involves consulting relevant physics principles, reviewing treatment planning data, and engaging with medical physics experts. The process should include a thorough review of the literature for similar phenomena and potential explanations. Based on the findings, a collaborative decision should be made regarding the cause of the discrepancy and the appropriate corrective actions, which may involve recalibration, replanning, or protocol modification, always prioritizing patient safety and treatment efficacy. Question 5. What factors determine the appropriateness of stereotactic body radiation therapy, SBRT, for a patient with a primary lung malignancy, considering both efficacy and safety within the established regulatory framework for radiation oncology practice? Option A. the historical success rates of SBRT for similar tumor sizes, irrespective of patient-specific factors or anatomical constraints. Option B, the patient's insurance coverage and the availability of the SBRT equipment at the treating facility. Option C, the precise delineation of the tumor and its relationship to critical surrounding structures, alongside the patient's overall health status and performance metrics. Option D, the physician's personal preference for SBRT as a treatment modality based on anecdotal experience. The correct answer is C, the precise delineation of the tumor and its relationship to critical surrounding structures, alongside the patient's overall health status and performance metrics. Explanation: this scenario is professionally challenging because it requires a physician to balance the potential benefits of a highly effective treatment modality like SBRT with the inherent risks and the need for precise patient selection and treatment delivery. The complexity arises from the need to integrate advanced imaging, sophisticated treatment planning, and rigorous quality assurance within the established regulatory framework for radiation oncology. Careful judgment is required to ensure patient safety and treatment efficacy while adhering to all applicable standards. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary evaluation of the patient and the tumor characteristics. This includes a thorough review of imaging for accurate tumor delineation and assessment of surrounding critical structures, consideration of the patient's overall health and performance status, and a clear understanding of the potential benefits and risks specific to SBRT for the given indication. This aligns with the principles of evidence-based medicine and patient-centered care, ensuring that SBRT is only offered when it is the most appropriate and safest treatment option, in accordance with the standards of care and regulatory guidelines for advanced radiation techniques. An incorrect approach that focuses solely on tumor size without considering the proximity to critical organs or the patient's comorbidities would be professionally unacceptable. This failure would violate the ethical obligation to provide individualized care and could lead to significant toxicity or suboptimal outcomes, potentially contravening regulatory requirements for appropriate patient selection and treatment planning. Another incorrect approach that neglects to involve a multidisciplinary team in the treatment planning process, such as excluding a medical physicist or radiation oncologist with SBRT expertise, would also be a failure. This oversight could compromise the technical aspects of treatment delivery and quality assurance, which are critical for the safe and effective application of SBRT and are often mandated by regulatory bodies to ensure patient safety. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical presentation, tumor characteristics, and available treatment options. This includes consulting relevant clinical guidelines and regulatory requirements, engaging in shared decision-making with the patient, and leveraging the expertise of a multidisciplinary team to optimize treatment planning and delivery. A commitment to continuous learning and adherence to quality improvement initiatives is also essential for managing complex radiation oncology treatments like SBRT. Question 6. Benchmark analysis indicates that emerging research on the tumor microenvironment, TME, is revealing novel targets for modulating treatment response to radiation therapy. Considering the regulatory framework for the Certificate of Added Qualification in Radiation Oncology exam, which approach best reflects the responsible integration of these TME insights into clinical practice? Option A. Immediately begin incorporating promising TME targeting agents into standard patient care protocols based on promising preclinical data to offer patients the most advanced treatment options. Option B. Advocate for the use of TME targeting agents in off-label settings for patients with limited treatment options, bypassing formal investigational review processes. Option C. Focus solely on established radiation oncology techniques, disregarding TME research as too experimental and not yet relevant for current clinical practice. Option D. Systematically evaluate preclinical and clinical data on TME modulating agents. Seek institutional review board and regulatory approval for investigational studies, and incorporate validated approaches into clinical trials or established treatment protocols. The correct answer is D. Systematically evaluate preclinical and clinical data on TME modulating agents. Seek institutional review board and regulatory approval for investigational studies, and incorporate validated approaches into clinical trials or established treatment protocols. Explanation: This scenario presents a professional challenge due to the inherent complexity of translating cutting-edge research on the tumor microenvironment, TME, into actionable clinical strategies within the established regulatory framework for radiation oncology. The difficulty lies in balancing the potential benefits of novel TME targeting approaches with the need for rigorous evidence, patient safety, and adherence to established treatment guidelines and investigational protocols. Careful judgment is required to discern between promising research and clinically validated interventions that meet the standards for patient care and regulatory approval. Correct approach represents best professional practice because it prioritizes patient safety and evidence-based medicine, aligning with the core principles of radiation oncology and the regulatory oversight governing new treatment modalities. This approach involves a systematic evaluation of TME modulating agents and their integration into radiation therapy, ensuring that any proposed changes are supported by robust preclinical and clinical data, reviewed by institutional ethics committees and regulatory bodies, such as the FDA in the U.S. context, and implemented within approved clinical trials or established treatment pathways. This ensures that patients receive treatments that have been vetted for efficacy and safety, minimizing risks associated with unproven therapies. An incorrect approach that involves unilaterally incorporating experimental TME targeting agents into standard radiation oncology practice without proper institutional review, ethical approval, or adherence to investigational new drug end. Regulations would represent a significant regulatory and ethical failure. This bypasses critical safety checks and balances designed to protect patients. It also violates the principles of informed consent, as patients would not be fully aware of the experimental nature of the treatment and its associated risks. Furthermore, such an approach could lead to inconsistent and potentially harmful treatment outcomes, undermining the integrity of the radiation oncology profession and potentially leading to disciplinary action. Another incorrect approach, such as dismissing all novel TME research as irrelevant to current practice, would be professionally suboptimal. While caution is warranted, a complete disregard for emerging TME science hinders progress and deprives patients of potentially life-saving advancements. This failure to engage with evolving knowledge can lead to stagnation in care and a missed opportunity to improve treatment efficacy and patient outcomes. Best professional practice demands a proactive yet critical engagement with new scientific discoveries. The professional decision-making process for similar situations should involve a multifaceted approach. 1. Evidence appraisal. Critically evaluate the quality and relevance of preclinical and clinical data supporting TME targeting strategies. 2. Regulatory navigation. Understand and adhere to all applicable regulatory requirements for investigational agents and novel treatment approaches, including FDA guidelines, institutional review board, ERB approvals, and institutional policies. 3. Multidisciplinary collaboration. Engage with colleagues across disciplines, including medical physicists, biologists, pharmacologists, and other oncologists, to gain a comprehensive understanding of the TME and its implications. 4. Ethical consideration. Prioritize patient safety, informed consent, and equitable access to potentially beneficial treatments. 5. Clinical trial design and participation. Actively participate in or design well-controlled clinical trials to rigorously test the efficacy and safety of TME modulating agents in conjunction with radiation therapy. 6. Continuous learning. Stay abreast of the latest research and advancements in TME biology and its clinical applications. Question 7. Regulatory review indicates a need to assess understanding of how radiation dose affects different tissue types. Considering the principles of radiobiology, which of the following best describes the expected differential response of normal tissues to ionizing radiation during a course of radiotherapy? Option A. All normal tissues exhibit a similar linear dose-response relationship, meaning that any increase in radiation dose will proportionally increase the risk of damage across all tissue types. Option B. Tissues with high cell turnover rates and poor repair mechanisms are generally more sensitive to radiation, leading to earlier onset of deterministic effects at lower doses compared to tissues with slow cell turnover and efficient repair. Option C. The primary determinant of tissue response to radiation is the total accumulated dose, irrespective of fractionation schedule or the inherent radiobiological properties of the tissue. Option D. Terminally differentiated cells, such as those in mature muscle and nerve tissue, are inherently more radiosensitive than actively dividing cells found in the basal layer of the epidermis. The correct answer is B. Tissues with high cell turnover rates and poor repair mechanisms are generally more sensitive to radiation, leading to earlier onset of deterministic effects at lower doses compared to tissues with slow cell turnover and efficient repair. Explanation: scenario analysis. This scenario presents a professional challenge because it requires the radiation oncologist to interpret complex radiobiological principles in the context of patient care and regulatory compliance. The challenge lies in balancing the theoretical understanding of radiation effects on different tissue types with the practical implications for treatment planning and patient safety, all while adhering to the specific guidelines of the Certificate of Added Qualification in Radiation Oncology exam. The need for a deep understanding of radiobiology, particularly the concept of tissue sensitivity and dose-response relationships, is paramount. Misinterpreting these principles can lead to suboptimal treatment or unnecessary toxicity, directly impacting patient outcomes and potentially violating professional standards. Correct approach analysis. The correct approach emphasizes the differential sensitivity of tissues to radiation, a cornerstone of radiobiology. Rapidly dividing cells, such as those in the gastrointestinal lining or bone marrow, are generally more sensitive to radiation than slowly dividing or terminally differentiated cells, like those in muscle or nerve tissue. This principle directly informs dose fractionation and overall treatment planning to maximize tumor control while minimizing damage to critical normal tissues. Adhering to established radiobiological models and guidelines, as expected by the CAQ exam, ensures that treatment decisions are evidence-based and prioritize patient safety and efficacy. This approach reflects best professional practice by applying fundamental scientific knowledge to clinical decision-making in a manner consistent with the rigorous standards of the CAQ certification. Incorrect approaches analysis. One incorrect approach might involve applying a uniform dose across all tissues regardless of their radiobiological properties. This fails to account for the differential sensitivity of normal tissues and could lead to unacceptable toxicity in radiosensitive organs, while potentially being insufficient for tumor control. This violates the fundamental principles of radiation oncology and the implicit requirements of the CAQ exam to demonstrate a sophisticated understanding of radiobiology. Another incorrect approach could be to solely focus on tumor response without adequately considering the potential for long-term damage to critical normal structures. While tumor control is a primary objective, radiation oncology mandates a careful balance between efficacy and morbidity. Ignoring the radiobiological characteristics of surrounding normal tissues, such as their repair capacity and dose-response curves, would be a significant professional and ethical failure, demonstrating a lack of comprehensive understanding expected of a CAQ-certified professional. A third incorrect approach might be to rely on anecdotal evidence or outdated practices rather than established radiobiological principles and current guidelines. The CAQ exam is designed to assess mastery of current, evidence-based practices. Deviating from these principles without strong scientific justification would be a clear regulatory and ethical failure, indicating a lack of commitment to continuous learning and adherence to professional standards. Professional reasoning. Professionals facing such scenarios should engage in a systematic decision-making process. This involves first identifying the core radiobiological principles relevant to the specific clinical situation. Next, they must consult and apply the established guidelines and best practices as dictated by the regulatory framework for the CAQ exam. This includes understanding the dose-volume histograms, linear no-threshold models for deterministic effects and stochastic effects, and how these apply to different tissue types. Finally, they must integrate this knowledge with the individual patient's clinical presentation and tumor characteristics to formulate a safe and effective treatment plan. Continuous self-assessment and staying abreast of advancements in radiobiology are crucial for maintaining the highest standards of care and compliance. Question 8. Risk assessment procedures indicate that the recent installation of a new, high-speed linear accelerator has the potential to alter scatter radiation patterns and necessitate adjustments to existing radiation safety protocols. Which of the following represents the most appropriate and professionally responsible approach to ensure continued radiation safety for patients, staff, and the public? Option A. Continue to adhere strictly to the previously established radiation safety protocols, assuming they are sufficient to cover the operational changes introduced by the new equipment. Option B. Conduct a comprehensive review and update of all radiation safety policies and procedures, including shielding assessments, dosimetry calibration, and staff training, specifically addressing the characteristics and operational parameters of the new linear accelerator. Option C. Implement a set of new, unverified safety protocols based on initial impressions of the new linear accelerator's performance, without formal testing or validation. Option D. Rely exclusively on the basic safety guidelines provided by the linear accelerator manufacturer, assuming these are comprehensive enough for the clinical setting. The correct answer is B. Conduct a comprehensive review and update of all radiation safety policies and procedures, including shielding assessments, dosimetry calibration, and staff training, specifically addressing the characteristics and operational parameters of the new linear accelerator. Explanation. Scenario analysis. This scenario presents a common implementation challenge in radiation oncology, balancing the need for efficient patient throughput with the paramount requirement of radiation safety. The introduction of a new, faster treatment delivery system, while beneficial for patient care and resource utilization, inherently alters the existing radiation safety protocols. The challenge lies in ensuring that the increased efficiency does not inadvertently compromise the safety of patients, staff, or the public, particularly concerning potential increases in scatter radiation or deviations from established dose monitoring procedures. This requires a proactive and thorough approach to reevaluate and adapt safety measures. Correct approach analysis. The correct approach involves a comprehensive review and update of existing radiation safety policies and procedures, specifically tailored to the new linear accelerator's capabilities and operational characteristics. This includes reevaluating shielding requirements, recalibrating dosimetry equipment for accurate dose monitoring, revising patient positioning and immobilization techniques to minimize unnecessary dose, and updating emergency protocols. Furthermore, it necessitates robust staff training on the new system's safety features and any modified procedures. This aligns with the fundamental principles of radiation protection, emphasizing ALARA as low as reasonably achievable and ensuring compliance with regulatory standards for radiation safety, such as those outlined by the American Association of Physicists in Medicine (APAM) and the Nuclear Regulatory Commission (NRC) in the U.S. The focus is on a systematic, evidence-based adaptation of safety measures to the new technology. Incorrect approaches analysis. Continuing with existing safety protocols without modification is professionally unacceptable because it fails to acknowledge the potential changes in radiation output, scatter patterns, or operational workflows introduced by the new technology. This directly violates the principle of ALARA and regulatory mandates that require facilities to maintain up-to-date safety assessments and procedures. Relying solely on the manufacturer's basic safety recommendations, while a starting point, is insufficient as it does not account for the specific clinical environment, patient population, or unique operational practices of the institution. This approach risks overlooking site-specific safety vulnerabilities. Implementing new, unverified safety protocols without rigorous testing and validation is also professionally unsound. It introduces uncertainty and potential for error, compromising patient and staff safety, and potentially leading to regulatory noncompliance. Professional reasoning. Professionals in radiation oncology must adopt a systematic decision-making process when integrating new technologies. This process begins with a thorough risk assessment, identifying potential hazards, and evaluating their likelihood and severity. Based on this assessment, appropriate control measures are developed, implemented, and continuously monitored. This involves consulting relevant regulatory guidelines, professional standards, and manufacturer specifications, but critically, adapting them to the specific clinical context. Ongoing training and education for all involved personnel are essential to ensure adherence to safety protocols. A culture of safety, where reporting of near misses and incidents is encouraged and acted upon, is fundamental to continuous improvement and maintaining the highest standards of radiation protection. Question 9. Operational review demonstrates that a new, advanced simulation technique offering potentially improved soft tissue visualization and reduced patient setup time is being considered for adoption by the Radiation Oncology Department. Which of the following approaches best aligns with regulatory requirements and professional best practices for evaluating and implementing such a technology? Option A. Implement the new simulation technique immediately, relying on the vendor's promotional materials and testimonials from other institutions to justify its adoption. Option B. Conduct a thorough literature review, engage in internal departmental validation of the technique's accuracy and reproducibility, and assess its impact on patient safety and treatment planning workflows before full implementation. Option C. Introduce the new simulation technique on a trial basis for a select group of patients, using anecdotal feedback from the treating physicians as the primary basis for continued use. Option D. Adopt the new simulation technique based on its advertised cost savings and the potential for increased patient throughput, without extensive clinical validation or safety assessments. The correct answer is B. Conduct a thorough literature review, engage in internal departmental validation of the technique's accuracy and reproducibility, and assess its impact on patient safety and treatment planning workflows before full implementation. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology, where technological advancements in simulation techniques necessitate a critical evaluation of their integration into established clinical workflows. The challenge lies in balancing the potential benefits of new technologies, such as improved accuracy and patient comfort, with the need to adhere to established best practices, regulatory requirements, and the practicalities of implementation within a radiation oncology department. Ensuring patient safety, treatment efficacy, and departmental efficiency requires a systematic and evidence-based approach to adopting new simulation modalities. Correct approach analysis. The correct approach, which involves a comprehensive evaluation of the new simulation technique against established quality assurance protocols, patient safety guidelines, and clinical efficacy data, represents best professional practice. This aligns with the fundamental principles of radiation oncology, which prioritize patient well-being and evidence-based medicine. Regulatory frameworks, such as those governing medical device utilization and patient care standards, implicitly or explicitly require such due diligence. This systematic review ensures that any new technique is not only technically sound, but also demonstrably beneficial and safe for the patient population, and that it can be integrated without compromising existing standards of care or regulatory compliance. Incorrect approaches analysis. Implementing a new simulation technique solely based on vendor claims without independent validation or departmental review represents a significant regulatory and ethical failure. This approach bypasses essential quality assurance processes designed to ensure patient safety and treatment accuracy, potentially leading to suboptimal or even harmful treatments. It also fails to comply with the spirit, if not the letter, of regulations that mandate the use of safe and effective medical technologies. Adopting a new simulation technique based on anecdotal evidence from a single institution without considering the broader applicability or potential limitations is also professionally unacceptable. This approach lacks the rigor of evidence-based practice and may not account for differences in patient populations, equipment, or departmental protocols. It risks introducing variability in care and may not meet the standards expected by regulatory bodies for widespread adoption. Prioritizing a new simulation technique solely due to its perceived cost-effectiveness, without a thorough assessment of its clinical impact and safety profile, is a critical ethical and regulatory lapse. While cost is a factor in healthcare, it must never supersede patient safety and treatment efficacy. This approach could lead to the adoption of a less effective or potentially unsafe technology, violating the professional obligation to provide the highest standard of care. Professional reasoning. Professionals in radiation oncology should employ a structured decision-making process when evaluating new simulation techniques. This process should include 1. Literature review and evidence appraisal to understand the scientific basis and reported outcomes of the technique. 2. Internal departmental review involving physicists, dosimetrists, and radiation oncologists to assess technical feasibility, integration into workflow, and potential impact on treatment planning. 3. Pilot testing and quality assurance to validate performance and safety in the local setting. 4. Consideration of regulatory requirements and institutional policies. 5. Cost-benefit analysis that includes clinical outcomes and patient safety as primary determinants. This systematic approach ensures that decisions are evidence-based, patient-centered, and compliant with all relevant professional and regulatory standards. Question 10. The audit findings indicate that the Radiation Oncology Department's Image-Guided Radiation Therapy (IGRT) protocol lacks specific, documented criteria for acceptable patient setup deviations, and the subsequent actions to be taken when these deviations exceed established tolerances. Which of the following approaches best addresses these audit findings in compliance with U.S. regulatory frameworks for radiation oncology? Option A. Conduct IGRT verification only on select treatment days or when a specific patient positioning issue is suspected, rather than as a routine part of each treatment fraction. Option B. Develop and implement a comprehensive IGRT protocol that clearly defines patient setup verification procedures, image acquisition parameters, image matching criteria, and specific tolerance limits for positional errors, along with a documented plan for corrective actions when tolerances are exceeded. Option C. Rely on the radiation therapist's clinical judgment to assess image registration accuracy and determine if treatment should proceed or be modified, without a formal, documented protocol for tolerance levels. Option D. Update the electronic medical record system to automatically flag any image registration discrepancies, but do not establish predefined tolerance limits or corrective action plans within the protocol. The correct answer is B. Develop and implement a comprehensive IGRT protocol that clearly defines patient setup verification procedures, image acquisition parameters, image matching criteria, and specific tolerance limits for positional errors, along with a documented plan for corrective actions when tolerances are exceeded. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology, where technological advancements in image-guided radiation therapy (IGRT) must be integrated into clinical practice while adhering to strict regulatory requirements for patient safety and quality assurance. The challenge lies in ensuring that the implementation of IGRT protocols aligns with established standards for accuracy, documentation, and ongoing verification, as mandated by regulatory bodies governing radiation oncology practice in the U.S. Failure to do so can compromise treatment efficacy and patient safety, leading to significant compliance issues. Correct approach analysis. The correct approach emphasizes the critical need for a comprehensive, documented, and regularly reviewed IGRT protocol that includes specific procedures for patient setup verification, image acquisition parameters, image matching criteria, and tolerance limits for positional errors. This aligns with the U.S. regulatory framework, which mandates robust quality assurance programs for radiation therapy. Specifically, guidelines from organizations like the American Association of Physicists in Medicine, (AAPM), and recommendations from the Accreditation Council for Radiation Oncology Practice, (ACRO), underscore the importance of standardized protocols for IGRT to ensure accurate dose delivery and patient safety. A well-defined protocol provides a clear roadmap for the clinical team, minimizes variability, and facilitates consistent application of IGRT principles, thereby meeting regulatory expectations for high-quality patient care. Incorrect approaches analysis. One incorrect approach involves relying solely on the machine's automated image registration without independent verification or established tolerance levels. This fails to meet regulatory requirements for independent checks and documented quality assurance. Regulatory bodies expect a systematic process for evaluating image registration accuracy, not just passive acceptance of automated results. This approach introduces a significant risk of undetected positional errors, compromising treatment accuracy and patient safety, and violating the principles of a robust quality assurance program. Another incorrect approach is to implement IGRT without a clear, written protocol that outlines specific procedures for patient setup, image acquisition, and error correction. This lack of standardization leads to inconsistent application of IGRT, increases the likelihood of errors, and makes it difficult to demonstrate compliance during audits. Regulatory frameworks require documented policies and procedures to ensure consistent and safe practice. Without such a protocol, the facility cannot adequately demonstrate that IGRT is being performed according to established best practices and regulatory standards. A third incorrect approach is to perform IGRT verification only sporadically or when a specific issue is suspected, rather than as a routine part of every treatment fraction. This deviates from the standard of care and regulatory expectations for IGRT, which is designed to ensure accurate daily setup. Sporadic verification means that significant positional errors could go unnoticed for extended periods, leading to compromised treatment delivery and potential harm to the patient. Regulatory oversight emphasizes proactive and consistent quality assurance measures. Professional reasoning. Professionals should approach IGIT implementation by first understanding the specific regulatory requirements and accreditation standards applicable to their practice. This involves developing a detailed written IGIT protocol that addresses all aspects of image acquisition, registration, and decision-making regarding treatment adjustments. The protocol should be reviewed and updated regularly based on technological advancements and clinical experience. Furthermore, ongoing quality assurance, including regular phantom studies and performance evaluations of the IGIT equipment, is essential. When faced with audit findings, the professional decision-making process should involve a thorough review of existing protocols and practices, identification of any gaps or deviations from regulatory requirements, and the implementation of corrective actions to ensure compliance and enhance patient safety. This systematic approach, grounded in regulatory compliance and best practices, is crucial for maintaining the integrity of radiation oncology services. Question 11. Strategic planning requires a radiation oncologist to consider the implications of a patient's tumor genetic profile on their predicted response to various radiation therapy fractionation schedules and concurrent systemic therapies. When evaluating a patient with a newly diagnosed non-small cell lung cancer exhibiting a specific CRAS mutation known to be associated with differential response to certain chemotherapy agents, which of the following approaches best aligns with current best practices and regulatory expectations for personalized radiation oncology care? Option A. Recommend against the use of concurrent systemic therapy altogether, as the presence of the CRAS mutation may indicate a poorer prognosis that could be exacerbated by chemotherapy, and focus solely on radiation therapy. Option B. Incorporate the CRAS mutation status into the overall treatment planning process, alongside clinical stage, performance status, and other relevant biomarkers, to inform the selection of optimal radiation fractionation and the choice of concurrent systemic therapy, ensuring the patient is fully informed of the rationale and potential implications. Option C. Solely base the radiation therapy fractionation schedule on the CRAS mutation status, prioritizing regimens that have shown promise in preclinical studies for this specific mutation, irrespective of other clinical factors or established treatment guidelines. Option D. Proceed with a standard, evidence-based radiation therapy protocol for non-small cell lung cancer without further consideration of the CRAS mutation, as its clinical utility in guiding radiation fractionation is not yet definitively established in all contexts. The correct answer is B. Incorporate the CRAS mutation status into the overall treatment planning process, alongside clinical stage, performance status, and other relevant biomarkers, to inform the selection of optimal radiation fractionation and the choice of concurrent systemic therapy, ensuring the patient is fully informed of the rationale and potential implications. Explanation. Scenario analysis. This scenario is professionally challenging because it requires integrating complex genetic and molecular data into clinical decision-making for radiation oncology treatment planning. The challenge lies in interpreting the prognostic and predictive significance of these factors, which are constantly evolving, and applying them ethically and effectively within the established regulatory framework for patient care. Balancing the potential benefits of personalized treatment with the uncertainties inherent in novel biomarkers, while ensuring patient autonomy and informed consent, demands careful judgment. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive, evidence-based evaluation of available genetic and molecular data in conjunction with established clinical and pathological factors. This aligns with the principles of precision medicine and the ethical imperative to provide the most effective and least toxic treatment possible. Specifically, it adheres to guidelines that encourage the use of validated biomarkers to inform treatment decisions, ensuring that such decisions are grounded in scientific evidence and patient-specific risk-benefit profiles. This approach respects the patient's right to understand all relevant factors influencing their care and supports shared decision-making, a cornerstone of ethical medical practice. Incorrect approaches analysis. One incorrect approach fails by solely relying on a single genetic marker without considering its predictive value in the context of the specific cancer type and stage, or without corroborating evidence from other clinical factors. This can lead to over- or undertreatment, potentially violating the principle of beneficence and non-maleficence. It may also fall short of regulatory expectations for evidence-based practice and could compromise informed consent if the limitations of the marker are not fully communicated. Another incorrect approach is to disregard all genetic and molecular data, opting for a standard treatment protocol regardless of individual patient profiles. This ignores the potential for personalized treatment that could improve outcomes or reduce toxicity, thereby failing to uphold the duty of care and potentially not providing the best available treatment. It also misses opportunities to advance the field through careful application of emerging knowledge. A third incorrect approach involves making treatment decisions based on preliminary or unvalidated research findings without robust clinical validation or established guidelines. This introduces undue risk to the patient and may not be supported by regulatory bodies or professional societies that emphasize evidence-based medicine and patient safety. It also undermines the integrity of the treatment planning process. Professional reasoning. Professionals should adopt a systematic approach that involves 1. Thoroughly reviewing the patient's clinical presentation, including histology, stage, and performance status. 2. Evaluating the available genetic and molecular data, assessing its prognostic and predictive significance based on high-quality evidence and established guidelines. 3. Integrating this information with other relevant factors to develop a personalized risk-benefit assessment. 4. Engaging in open and transparent communication with the patient, explaining the implications of the genetic and molecular findings, the uncertainties involved, and the rationale behind proposed treatment options. 5. Documenting the decision-making process meticulously, including the patient's input and the justification for the chosen treatment plan. This process ensures that treatment decisions are both scientifically sound and ethically defensible, aligning with the highest standards of radiation oncology practice. Question 12. Cost-benefit analysis shows that while a more complex brachytherapy technique might offer superior local control for a specific gynecologic malignancy, a simpler, albeit less precise, method is significantly less resource-intensive and requires less specialized training for the radiation oncology team. Considering the Certificate of Added Qualification in Radiation Oncology exam's regulatory framework, which emphasizes patient safety, efficacy, and responsible resource allocation, what is the most appropriate course of action? Option A. Recommend alternative treatment modalities that do not involve brachytherapy, given the resource constraints and the perceived trade-off between efficacy and complexity, to avoid potential complications associated with the more complex technique. Option B. Advocate for the adoption of the simpler brachytherapy technique, while simultaneously initiating a robust quality improvement program to mitigate potential risks and enhance its efficacy, thereby balancing cost-effectiveness with patient safety. Option C. Implement the simpler brachytherapy technique, prioritizing resource efficiency and team familiarity, as the overall benefit to the patient population served by the institution outweighs the marginal potential gain in local control from the more complex method. Option D. Proceed with the more complex brachytherapy technique, ensuring all necessary resources and training are secured, as the potential for improved local control and reduced long-term toxicity for individual patients aligns with the highest standards of oncologic care and regulatory expectations for advanced treatment modalities. The correct answer is C. Implement the simpler brachytherapy technique, prioritizing resource efficiency and team familiarity, as the overall benefit to the patient population served by the institution outweighs the marginal potential gain in local control from the more complex method. Explanation. This scenario presents a professional challenge due to the inherent complexities of brachytherapy, specifically the need to balance the potential for improved local control and reduced toxicity with the technical demands and resource allocation required for its implementation. The decision-making process is further complicated by the need to adhere strictly to the regulatory framework governing radiation oncology practice, which emphasizes patient safety, efficacy, and appropriate resource utilization. The correct approach represents best professional practice because it prioritizes a comprehensive evaluation of patient-specific factors, tumor characteristics, and the available technological infrastructure, all within the established regulatory guidelines. This ensures that brachytherapy is only recommended when it offers a demonstrable clinical advantage and can be delivered safely and effectively, aligning with the principles of evidence-based medicine and patient-centered care. Adherence to established protocols and quality assurance measures, as mandated by regulatory bodies, is paramount to minimizing risks and maximizing therapeutic benefit. An incorrect approach that focuses solely on the perceived cost savings of a less complex technique, without adequately considering its potential impact on local control or the increased risk of complications, would represent a failure to uphold the primary ethical obligation to provide the best possible patient care. This could also violate regulatory requirements that mandate the use of techniques proven to be effective and safe for specific indications. Another incorrect approach that involves implementing a novel brachytherapy technique without rigorous validation, peer review, or adherence to established quality assurance protocols would be a direct contravention of regulatory mandates for patient safety and the responsible adoption of new technologies. This could expose patients to undue risks and compromise the integrity of the radiation oncology service. A third incorrect approach that neglects to involve a multidisciplinary team in the treatment planning and delivery process would fail to meet the standards of comprehensive cancer care, potentially leading to suboptimal outcomes and overlooking critical aspects of patient management that are often implicitly or explicitly required by regulatory oversight. The professional reasoning process for similar situations should involve a systematic evaluation of treatment options, considering not only efficacy and toxicity, but also the technical feasibility, resource availability, and regulatory compliance. This includes a thorough review of the latest evidence, consultation with multidisciplinary teams, and a clear understanding of institutional policies and regulatory requirements. The ultimate decision should be patient-centric, aiming to achieve the best possible oncologic outcome with the lowest acceptable risk, within the established ethical and legal framework. Question 13. Cost-benefit analysis shows that implementing a new, more rigorous patient positioning verification system would incur significant upfront costs and ongoing maintenance expenses, potentially impacting departmental budgets. However, historical data from similar institutions suggests a reduction in treatment delivery errors and a corresponding decrease in the likelihood of patient harm. Considering the regulatory framework for radiation oncology in the United States, which mandates a commitment to patient safety and quality assurance, what is the most appropriate course of action for the radiation oncology department? Option A. Defer the implementation of the new system, citing the unfavorable initial cost-benefit analysis and relying on existing, less stringent verification protocols. Option B. Conduct a further, more detailed cost-benefit analysis focusing solely on quantifiable financial returns, delaying any decision until a clear financial advantage is demonstrated. Option C. Implement the new patient positioning verification system, prioritizing patient safety and regulatory compliance over immediate cost concerns. Option D. Negotiate with the vendor for a phased implementation of the new system, accepting a reduced level of verification initially to manage upfront costs. The correct answer is C. Implement the new patient positioning verification system, prioritizing patient safety and regulatory compliance over immediate cost concerns. Explanation. This scenario is professionally challenging because it requires balancing the immediate financial implications of a safety protocol against the potential, albeit less quantifiable, risks to patient well-being and the institution's long-term reputation and legal standing. The pressure to reduce costs can create a conflict with the fundamental ethical and regulatory imperative to prioritize patient safety above all else. Careful judgment is required to assess the true cost of a safety lapse, which extends beyond direct financial penalties to include patient harm, loss of trust, and potential litigation. The correct approach represents best professional practice because it aligns with the core principles of radiation oncology and regulatory mandates that emphasize proactive risk management and patient safety. By investing in enhanced quality assurance measures, even if the immediate cost-benefit analysis appears unfavorable, the institution demonstrates a commitment to preventing errors before they occur. This proactive stance is mandated by regulatory bodies that expect healthcare providers to implement robust systems to minimize radiation-related risks. Ethically, It upholds the principle of non-maleficence by actively working to avoid harm. An incorrect approach that prioritizes immediate cost savings over necessary safety upgrades is professionally unacceptable. This failure represents a direct violation of regulatory requirements that mandate adherence to established safety standards and quality assurance protocols. Ethically, it breaches the duty of care owed to patients, prioritizing financial gain over their well-being, which is a fundamental ethical failing. Such an approach also exposes the institution to significant legal and reputational risks, as regulatory bodies can impose severe penalties for noncompliance, and patient harm can lead to devastating lawsuits and a loss of public trust. The professional decision-making process for similar situations should involve a comprehensive risk assessment that goes beyond simple financial calculations. It requires considering the likelihood and severity of potential adverse events, the effectiveness of proposed mitigation strategies, and the regulatory and ethical obligations of the practice. When faced with a conflict between cost and safety, professionals must advocate for the safest course of action, even if it incurs higher upfront costs. This involves engaging with stakeholders, including clinical staff and administrators, to articulate the rationale for safety investments, and to ensure that patient well-being remains the paramount consideration in all operational decisions. Question 14. The evaluation methodology shows a radiation oncology department reviewing protocols for different therapeutic modalities. A junior physicist proposes a unified safety and efficacy assessment framework for all electromagnetic energy used in patient care, arguing that the term radiation implies a common set of risks and management strategies. The senior physicist needs to guide the junior physicist on the appropriate classification and regulatory implications of different radiation types. Which of the following approaches best reflects the regulatory framework and best practices in radiation oncology? Option A. Implement a single, comprehensive safety and efficacy assessment for all electromagnetic energy used in patient care, assuming similar biological interactions and regulatory requirements regardless of ionization potential. Option B. Categorize all electromagnetic energy used in medical treatments as radiation therapy and subject them to the same stringent dose management and shielding requirements as high-energy ionizing radiation. Option C. Differentiate strictly between ionizing and non-ionizing radiation based on their energy levels and potential to cause ionization, applying distinct regulatory frameworks, safety protocols, and treatment considerations for each. Option D. Focus primarily on the perceived intensity or power of the electromagnetic energy source when determining safety protocols, as higher power generally correlates with greater risk. The correct answer is C. Differentiate strictly between ionizing and non-ionizing radiation based on their energy levels and potential to cause ionization, applying distinct regulatory frameworks, safety protocols, and treatment considerations for each. Explanation. The evaluation methodology shows a scenario where a radiation oncology team is reviewing treatment plans for different patient populations. The challenge lies in accurately distinguishing between ionizing and non-ionizing radiation, and understanding their distinct biological effects and regulatory oversight, particularly in the context of patient safety and treatment efficacy. Misclassification can lead to inappropriate treatment selection, inadequate safety protocols, and non-compliance with regulatory standards. The correct approach involves a thorough understanding of the fundamental physics of radiation and its interaction with biological tissues, as defined by the regulatory framework governing radiation oncology practice in the United States. This framework, including guidelines from the FDA and professional bodies like the American Association of Physicists in Medicine (APA), mandates precise classification of radiation types based on their energy levels and potential to cause ionization. Ionizing radiation, characterized by its ability to remove electrons from atoms and molecules, is the basis for radiation therapy and requires stringent safety measures and dose management due to its potential for cellular damage. Non-ionizing radiation, conversely, does not possess sufficient energy to ionize atoms and has different biological interactions and applications, often falling under different regulatory oversight. An incorrect approach would be to broadly categorize all forms of electromagnetic energy used in medical settings as radiation, without differentiating their ionizing potential. This fails to acknowledge the critical distinction that underpins radiation safety and treatment planning in radiation oncology. For instance, assuming that all electromagnetic therapies carry the same risks or require the same protective measures as ionizing radiation would lead to unnecessary alarm and inefficient resource allocation, while also potentially overlooking specific risks associated with non-ionizing modalities if they were to be used in a therapeutic context. Another incorrect approach would be to rely solely on the perceived danger of a radiation source without understanding its physical properties, leading to misapplication of safety protocols. The regulatory framework emphasizes a scientific basis for classification and management, not subjective perception. Professionals should employ a decision-making process that begins with identifying the specific type of radiation being considered. This involves consulting physics principles and established classifications within the radiation oncology domain. Next, they must determine whether the radiation is ionizing or non-ionizing based on its energy and interaction with matter. Finally, they should apply the relevant regulatory guidelines and safety protocols specific to that classification, ensuring patient safety and treatment integrity. This systematic approach, grounded in scientific understanding and regulatory compliance, is paramount in radiation oncology. Question 15. The evaluation methodology shows a radiation oncologist reviewing a patient's case with newly available genomic profiling results. These results indicate the presence of a specific molecular alteration that has shown promise in preclinical studies and early-phase clinical trials as a predictor of response to a particular radiation sensitizer. The oncologist must decide whether to incorporate this information into the patient's treatment plan, which currently involves standard of care radiation therapy. Option A. Inform the patient that the biomarker information is experimental and not relevant to current radiation oncology practice, and proceed with standard treatment without further investigation. Option B. Proceed with standard radiation therapy without further consideration of the biomarker, as the evidence for its clinical utility in routine practice is not yet definitive. Option C. Discuss the biomarker findings with the patient. Review the latest peer-reviewed literature and institutional guidelines regarding this specific biomarker and its potential impact on radiation sensitizer use, and consider enrollment in a relevant clinical trial if available, before making a treatment decision. Option D. Immediately prescribe the radiation sensitizer alongside standard radiation therapy, based solely on the promising preclinical data and the presence of the molecular alteration. The correct answer is C. Discuss the biomarker findings with the patient. Review the latest peer-reviewed literature and institutional guidelines regarding this specific biomarker and its potential impact on radiation sensitizer use, and consider enrollment in a relevant clinical trial if available, before making a treatment decision. Explanation. The evaluation methodology shows a complex clinical scenario where a radiation oncologist must integrate emerging biomarker data into treatment planning for a patient with a specific cancer type. This is professionally challenging because the evidence base for many biomarkers in radiation oncology is still evolving, and regulatory guidelines may lag behind scientific advancements. The oncologist must balance the potential benefits of personalized therapy with the risks of off-protocol treatment, ensuring patient safety and adherence to established standards of care, while also striving for optimal outcomes. Careful judgment is required to interpret the biomarker results in the context of the patient's overall clinical picture and available treatment options. The correct approach represents best professional practice because it involves a thorough, evidence-based, and patient-centered decision-making process. This includes consulting current clinical practice guidelines, reviewing peer-reviewed literature on the specific biomarker's predictive or prognostic value in the context of radiation oncology, and engaging in shared decision-making with the patient. This approach prioritizes patient safety, informed consent, and adherence to the highest standards of care, aligning with the ethical principles of beneficence and autonomy. It also implicitly acknowledges the need to stay abreast of evolving scientific knowledge, while operating within a responsible framework. An incorrect approach that relies solely on a single, unvalidated biomarker result without considering the broader clinical context or established guidelines would be professionally unacceptable. This could lead to inappropriate treatment decisions, potentially exposing the patient to unnecessary toxicity or foregoing more effective standard therapies. Such an approach would fail to meet the ethical obligation of providing evidence-based care and could violate professional standards that mandate a comprehensive assessment. Another incorrect approach would be to disregard the biomarker information entirely, even if it suggests a potential for improved outcomes or reduced toxicity with a modified treatment strategy. This failure to consider potentially valuable prognostic or predictive information could be seen as a missed opportunity to optimize patient care and might not align with the evolving landscape of precision medicine in radiation oncology. It could also be interpreted as a lack of engagement with advancements in the field. Finally, an approach that deviates from established protocols based on biomarker data without appropriate institutional review, ethical consultation, or robust scientific justification would be professionally unsound. This could expose the institution and the practitioner to regulatory scrutiny and compromise patient safety by undertaking unproven interventions without adequate oversight. The professional reasoning process for similar situations should involve a systematic evaluation. 1. Assess the patient's clinical status and diagnosis. 2. Identify relevant biomarkers and their established or emerging roles in radiation oncology for this specific cancer. 3. Consult current, evidence-based clinical practice guidelines and relevant literature. 4. Evaluate the quality and strength of evidence supporting the biomarker's utility. 5. Consider the potential benefits and risks of incorporating biomarker information into treatment planning. 6. Engage in open and transparent communication with the patient, explaining the findings, uncertainties, and treatment options. 7. Seek multidisciplinary input when necessary. 8. Document the decision-making process thoroughly. Question 16. Compliance review shows that for a patient with locally advanced squamous cell carcinoma of the oropharynx, the radiation oncology team is considering volumetric modulated arc therapy (VMAT) for treatment planning. While VMAT offers potential advantages in dose conformity and OAR sparing, the institution has historically utilized intensity-modulated radiation therapy (IMiT) for such cases. With well-established protocols and outcomes, the physician must decide whether to proceed with VMAT or IMiT. Which of the following represents the most appropriate approach to this decision-making process, adhering to best practices and regulatory expectations for radiation oncology? Option A. Proceed with VMAT, as it is a more advanced technology and is generally considered superior for complex head and neck cases, assuming the planning system can generate a technically sound plan. Option B. Conduct a detailed comparative analysis of the proposed VMAT plan against a benchmark IMiT plan for this specific patient, evaluating dosimetric parameters, OAR sparing, and predicted toxicity, and consult relevant clinical guidelines and evidence before making a final decision. Option C. Continue with the established IMiT protocol, as it is a proven technique with predictable outcomes, and avoid the potential complexities and uncertainties associated with implementing a newer technology for this patient. Option D. Implement VMAT only after a significant number of similar cases have been successfully treated with VMAT at other institutions, and the results have been published in peer-reviewed journals. Correct answer is A. Proceed with VMAT, as it is a more advanced technology and is generally considered superior for complex head and neck cases, assuming the planning system can generate a technically sound plan. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology treatment planning, where a physician must balance the desire for optimal tumor coverage with the need to minimize dose to critical organs at risk, or the introduction of a new, advanced technology like volumetric modulated arc therapy, VMAT, for a complex case, such as a locally advanced head and neck cancer, requires careful consideration of its potential benefits and risks, especially when existing protocols might favor a more established technique. The professional challenge lies in making an evidence-based and patient-centered decision that adheres to established standards of care, while also exploring potentially superior treatment modalities, all within the regulatory framework governing radiation oncology practice. Correct approach analysis. The correct approach emphasizes a thorough, multidisciplinary evaluation of the patient's specific anatomy, tumor characteristics, and OAR constraints. It prioritizes a detailed review of the proposed VMAT plan against established dosimetric benchmarks and clinical outcomes for similar cases, referencing relevant guidelines from professional bodies and regulatory agencies. This approach aligns with the principles of evidence-based medicine and patient safety, ensuring that the adoption of new technology is justified by demonstrable improvements in treatment efficacy or toxicity reduction. The regulatory framework for radiation oncology, which often mandates adherence to established standards and requires justification for deviations, is best met by this systematic and data-driven decision-making process. This ensures that patient care is not compromised by the introduction of novel techniques without adequate validation. Incorrect approaches analysis. One incorrect approach involves proceeding with VMAT solely based on the perceived technological superiority without a rigorous comparative analysis against the standard technique. This fails to meet the regulatory expectation of demonstrating clinical benefit and potentially exposes the patient to unforeseen risks or suboptimal outcomes. It bypasses the critical step of verifying that the new technology actually improves upon existing methods for this specific patient and disease site, which is a cornerstone of responsible medical practice and regulatory oversight. Another incorrect approach is to dismiss VMAT without a comprehensive evaluation, adhering rigidly to older protocols. While established protocols offer a baseline of safety and efficacy, they may not represent the most advanced or beneficial treatment option available. Regulatory bodies and professional guidelines encourage the adoption of proven advancements that can enhance patient care. Failing to explore and evaluate potentially superior techniques, especially when supported by emerging evidence, can be seen as a failure to provide the highest standard of care. A third incorrect approach is to rely solely on vendor-provided information or anecdotal evidence for VMAT implementation. Regulatory frameworks typically require independent verification of technology performance and clinical utility. Over-reliance on marketing materials or limited case studies without independent validation can lead to the adoption of technologies that are not fully understood or appropriately applied, potentially jeopardizing patient safety and treatment outcomes. Professional reasoning. Professionals should approach such decisions by first understanding the patient's unique clinical situation. This involves a thorough review of imaging, pathology, and patient comorbidities. Next, they should consult current evidence-based guidelines and literature pertaining to treatment options for the specific diagnosis and stage. A multidisciplinary team discussion, including radiation oncologists, medical physicists, and dosimetrists, is crucial for evaluating the feasibility and potential benefits of advanced techniques like VMAT. This evaluation should include a quantitative comparison of dose distributions, OAR sparing, and predicted toxicity profiles between the proposed VMAT plan and the standard technique. Finally, the decision should be documented, clearly articulating the rationale for choosing a particular treatment approach, especially when it involves novel technologies. This systematic process ensures that decisions are patient-centered, evidence-based, and compliant with regulatory requirements. Question 17. The performance metrics show a suboptimal response to standard radiation therapy in a patient with locally advanced squamous cell carcinoma of the head and neck. Biopsy specimens reveal a high expression of HIF-1 and evidence of increased angiogenesis within the tumor microenvironment. Considering the known mechanisms of tumor resistance to radiation, which of the following investigations would be most crucial in guiding further therapeutic decisions? Option A. Assessing the tumor's DNA damage repair capacity and evaluating the expression of key proteins involved in cell cycle regulation. Option B. Performing a detailed histopathological review to confirm the initial diagnosis and staging. Option C. Evaluating the patient's nutritional status and psychological well-being. Option D. Measuring serum levels of tumor markers commonly associated with head and neck cancers. Correct answer is A. Assessing the tumor's DNA damage repair capacity and evaluating the expression of key proteins involved in cell cycle regulation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the radiation oncologist to interpret complex molecular and cellular data in the context of a patient's treatment response, specifically addressing mechanisms of tumor resistance. The physician must move beyond standard treatment protocols to understand the underlying biological reasons for a suboptimal outcome, necessitating a deep understanding of radiobiology and tumor microenvironment interactions. This requires careful judgment to differentiate between common resistance mechanisms and those that might be amenable to novel therapeutic strategies, while also considering the patient's overall clinical status and potential for further intervention. Correct approach analysis. The correct approach involves a comprehensive review of the patient's tumor biology, including genetic mutations, protein expression profiles, and the tumor microenvironment, to identify specific mechanisms of radiation resistance. This aligns with best professional practice by employing an evidence-based, personalized medicine approach. It is ethically justified by the principle of beneficence, aiming to optimize patient care by understanding and potentially overcoming treatment failure. Regulatory frameworks, such as those guiding the Certificate of Added Qualification in Radiation Oncology, emphasize a deep understanding of radiobiology and treatment response, which this approach directly addresses. By investigating specific pathways like DNA repair deficiencies, hypoxia, or altered cell cycle regulation, the physician can tailor subsequent treatment or supportive care. Incorrect approaches analysis. One incorrect approach would be to attribute the lack of response solely to intrinsic tumor radioresistance without further investigation. This fails to meet the professional standard of care by neglecting to explore specific, actionable resistance mechanisms. It could be considered a failure of due diligence and potentially a violation of the principle of non-maleficence if it leads to continued ineffective treatment. Another incorrect approach would be to immediately escalate to highly toxic or experimental therapies without a clear biological rationale derived from the patient's tumor characteristics. This disregards the need for a targeted, evidence-informed strategy and could expose the patient to undue harm without a reasonable expectation of benefit, violating ethical principles of proportionality and patient safety. A third incorrect approach would be to dismiss the resistance as untreatable and cease all further oncologic management without exploring all viable options. This could be seen as abandoning the patient and failing to uphold the commitment to provide the best possible care within the bounds of medical possibility. It neglects the potential for palliative strategies or clinical trial enrollment that could still offer benefit. Professional reasoning. Professionals should approach such scenarios by first conducting a thorough review of the patient's initial presentation and treatment response. This should be followed by a detailed analysis of the tumor's biological characteristics, utilizing available diagnostic tools to identify potential resistance mechanisms. Based on this analysis, the physician should then formulate a personalized treatment plan, which may include re-irradiation, combination therapies, or enrollment in clinical trials, always prioritizing patient safety and informed consent. This systematic, evidence-based approach ensures that decisions are not only clinically sound, but also ethically and regulatorily compliant. Question 18. Governance review demonstrates a potential for inconsistency in the application of a specific quality assurance protocol for daily patient setup verification in external beam radiation therapy, specifically concerning the interpretation of image-based verification tolerances. Which of the following represents the most appropriate best practice approach to address this finding? Option A. Acknowledge the governance review finding in the meeting minutes, but defer any protocol changes until the next scheduled annual QA review cycle to avoid disrupting current workflows. Option B. Convene a multidisciplinary team including radiation oncologists, medical physicists, and dosimetrists to review the existing protocol, analyze the observed inconsistencies, and propose evidence-based modifications or clarifications to the tolerance levels and their interpretation, followed by formal retraining and documentation. Option C. Direct the radiation therapists to exercise their best clinical judgment on a case-by-case basis when interpreting image-based verification results that fall outside the current stated tolerances. Option D. Implement a temporary, more stringent set of tolerance levels for image-based verification across all patients until a comprehensive review can be completed, to err on the side of caution. The correct answer is B. Convene a multidisciplinary team including radiation oncologists, medical physicists, and dosimetrists to review the existing protocol, analyze the observed inconsistencies, and propose evidence-based modifications or clarifications to the tolerance levels and their interpretation, followed by formal retraining and documentation. Explanation. This scenario presents a common challenge in radiation oncology quality assurance, balancing the need for rigorous protocol adherence with the practical realities of patient care and resource allocation. The professional challenge lies in ensuring patient safety and treatment efficacy without introducing undue delays or compromising the quality of care due to overly rigid or inefficient processes. Careful judgment is required to identify and implement QA measures that are both effective and sustainable within the clinical environment. The correct approach represents best professional practice because it directly addresses a potential gap in the established QA protocol by proactively seeking expert input and validating the proposed modification against established guidelines and evidence. This demonstrates a commitment to continuous improvement and patient safety, aligning with the core principles of radiation oncology practice. Specifically, it adheres to the spirit of regulatory frameworks that emphasize evidence-based practice and the importance of robust QA programs to ensure accurate and safe treatment delivery. Seeking peer review and validation before implementation ensures that any deviation from the standard protocol is well justified, understood, and unlikely to compromise patient outcomes. An incorrect approach that involves unilaterally altering the established QA protocol without proper validation or peer review represents a significant regulatory and ethical failure. This bypasses the established safety checks and balances designed to protect patients. It could lead to unintended consequences, such as inconsistent treatment delivery, compromised accuracy, or a failure to detect critical errors, all of which violate the fundamental duty of care and could contravene specific regulations governing radiation therapy practice that mandate adherence to approved protocols and rigorous QA procedures. Another incorrect approach, which is to ignore the potential issue identified by the governance review and continue with the existing protocol, is also professionally unacceptable. This demonstrates a lack of proactive engagement with quality improvement and a failure to address potential risks. It suggests a passive acceptance of the status quo, even when evidence suggests a need for review, which can lead to the perpetuation of suboptimal or potentially unsafe practices, undermining the integrity of the QA program and patient safety. The professional reasoning framework for similar situations should involve a systematic approach to identifying and addressing potential quality gaps. This includes 1. Acknowledging and thoroughly investigating any identified issues through data review and process analysis. 2. Consulting relevant internal and external experts, including physicists, dosimetrists, and radiation oncologists, to gain diverse perspectives. 3. Evaluating proposed changes against established clinical guidelines, regulatory requirements, and evidence-based practice. 4. Implementing changes through a controlled process, including appropriate training and documentation. 5. Establishing mechanisms for ongoing monitoring and evaluation of the implemented changes to ensure continued effectiveness and safety. Question 19. Stakeholder feedback indicates that some patients undergoing palliative radiation therapy express concerns about the intensity of treatment and its potential impact on their remaining quality of life, even when the stated goal is symptom relief. A patient with advanced metastatic disease, experiencing significant bone pain, has been recommended a course of palliative radiation. The patient, however, expresses a desire for the gentlest possible treatment to avoid any discomfort from the radiation itself, stating they are more worried about feeling unwell from the treatment than the pain itself. How should the radiation oncology team best address this patient's concerns and align the treatment plan with their stated priorities? Option A. Proceed with a standard palliative radiation dose and fractionation schedule, assuming the patient's primary concern is pain relief and that any discomfort from treatment is an acceptable trade-off for pain reduction. Option B. Administer a significantly reduced dose of radiation, far below established palliative protocols, to ensure minimal patient discomfort, even if it means a lower likelihood of achieving adequate pain relief. Option C. Engage in a detailed discussion with the patient and their family to clarify the specific goals of palliative radiation, explain the spectrum of available techniques and dose fractionation schedules, and collaboratively determine a treatment plan that maximizes symptom relief while minimizing potential treatment-related toxicity, respecting the patient's preference for gentleness. Option D. Recommend against palliative radiation therapy altogether, suggesting only supportive care and pain medication, as the patient's expressed fear of treatment discomfort outweighs the potential benefits of radiation for pain control. The correct answer is C. Engage in a detailed discussion with the patient and their family to clarify the specific goals of palliative radiation, explain the spectrum of available techniques and dose fractionation schedules, and collaboratively determine a treatment plan that maximizes symptom relief while minimizing potential treatment-related toxicity, respecting the patient's preference for gentleness. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in palliative radiation oncology, balancing patient autonomy and the desire to provide comfort with the potential for unintended consequences or misinterpretation of goals. The challenge lies in navigating the patient's expressed wishes, which may be influenced by a lack of complete understanding of radiation therapy's effects, against the physician's professional judgment and the established principles of palliative care. Ensuring informed consent, respecting patient values, and maintaining open communication are paramount. Correct approach analysis. The correct approach prioritizes a thorough, empathetic discussion with the patient and their family to clarify the goals of palliative radiation therapy. This involves explaining the potential benefits, symptom relief, improved quality of life, and realistic limitations, not curative potential side effects, in clear, understandable language. It emphasizes shared decision-making, ensuring the patient's values and preferences are central to the treatment plan. This aligns with the ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory guidelines that mandate informed consent and patient-centered care in radiation oncology. The focus is on achieving the patient's desired outcomes within the scope of palliative care. Incorrect approaches analysis. One incorrect approach involves proceeding with a high-dose palliative radiation regimen without fully exploring the patient's understanding and goals. This fails to uphold the principle of informed consent, as the patient may not be aware of the full implications or alternatives. It risks causing unnecessary toxicity or distress if the patient's primary goal is comfort and minimal intervention, potentially violating the principle of non-maleficence. Another incorrect approach is to dismiss the patient's request outright due to a perceived lack of benefit or potential for harm, without engaging in a detailed discussion. This disregards patient autonomy and the patient's right to make decisions about their care, even if those decisions differ from the physician's initial recommendation. It can lead to a breakdown in the patient-physician relationship and a failure to address the patient's underlying concerns. A third incorrect approach is to agree to a treatment plan that is clearly not aligned with palliative goals, such as a curative intent dose or technique, simply to appease the patient. This misrepresents the purpose of palliative radiation and can lead to significant toxicity without achieving the desired symptom relief, ultimately failing the patient and violating the principles of beneficence and non-maleficence. Professional reasoning. Professionals should employ a structured decision-making process that begins with active listening and empathetic engagement to understand the patient's perspective, fears, and goals. This is followed by clear, jargon-free education about the proposed treatment, its benefits, risks, and alternatives, tailored to the patient's level of understanding. The process then moves to collaborative decision-making, where the patient's values are integrated into the treatment plan. Regular reassessment of goals and patient response is crucial throughout the course of care. This framework ensures that treatment is both medically appropriate and ethically sound, respecting the patient's dignity and autonomy. Question 20. The assessment process reveals a patient with locally advanced squamous cell carcinoma of the head and neck, stage T4N2BM0. The multidisciplinary tumor board is considering various treatment strategies. Which of the following approaches best reflects a comprehensive and evidence-based strategy for this patient? Option A. Concurrent chemoradiation followed by consideration of salvage surgery if residual disease is present. Option B. Concurrent chemoradiation with the intent of definitive treatment without immediate surgical planning. Option C. Induction chemotherapy followed by concurrent chemoradiation and definitive surgery. Option D. Neoadjuvant chemotherapy followed by concurrent chemoradiation and then definitive surgery. The correct answer is A. Concurrent chemoradiation followed by consideration of salvage surgery if residual disease is present. Explanation. This scenario presents a professionally challenging situation due to the inherent complexities of integrating multiple treatment modalities, each with its own toxicity profile and potential for synergistic or antagonistic effects. The physician must balance the potential benefits of combined therapy against the risks of increased morbidity, and ensure that the treatment plan is tailored to the individual patient's specific disease characteristics and overall health status. Careful judgment is required to optimize oncologic outcomes while minimizing treatment-related harm. The correct approach represents best professional practice because it prioritizes a multidisciplinary discussion and a comprehensive assessment of the patient's condition. This aligns with the principles of evidence-based medicine and patient-centered care, which are fundamental to radiation oncology practice. Specifically, it ensures that the decision to combine radiation with chemotherapy and surgery is based on the most current scientific literature, established clinical guidelines, and a thorough understanding of the patient's comorbidities, performance status, and potential for treatment-related toxicities. This collaborative approach, often facilitated by tumor boards, is crucial for developing an individualized and optimal treatment strategy. An incorrect approach that solely focuses on administering chemotherapy concurrently with radiation without a surgical plan fails to consider the potential benefits of surgical resection in achieving local control and reducing tumor burden, which may be a critical component of curative intent for certain malignancies. This could lead to suboptimal oncologic outcomes. Another incorrect approach that proposes sequential administration of all three modalities without considering the potential for accelerated repopulation between treatments or the synergistic benefits of concurrent administration overlooks established treatment paradigms that have demonstrated superior efficacy in specific clinical contexts. Furthermore, an approach that neglects to discuss the potential for additive toxicities between radiation and chemotherapy or between surgery and radiation risks significant patient harm and violates the ethical principle of non-maleficence. Professional decision-making in such situations should involve a systematic process. First, thoroughly reviewing the patient's diagnosis, staging, and relevant imaging. Second, consulting current evidence-based guidelines and landmark clinical trials for the specific cancer type and stage. Third, engaging in a multidisciplinary team discussion to integrate surgical, medical oncology, and radiation oncology perspectives. Fourth, conducting a comprehensive assessment of the patient's performance status, comorbidities, and psychosocial factors. And finally, engaging in shared decision-making with the patient, clearly outlining the risks, benefits, and alternatives of different treatment strategies.